on behalf of the Office of the Vice President for Health Sciences, my name is Jill Cezak, and I work with Dr. Allison Brashear, not as the Dean of the Jacobs School of Medicine, but as the hat that she wears as VP for the health science schools and specifically administration and support of the schools and things like this as related to programming. So our office was fortunate to collaborate with the Jacob School Office of Faculty Affairs. Dr. Ariza Balaga brought this concept to us. He's on, and he has implemented a similar series at a previous institution. And I can say that his first session that we hosted last week, I believe, was extremely well received. And as we were just discussing, for many of you that might have been listening in, is posted to our Health Sciences YouTube channel, as this will be as well. So I want to thank our panelists today for agreeing to join. We have talent from all across the health science schools. So Dr. Barrick is coming to us from the UB School of Nursing. Dr. Collins is situated in the School of Public Health and Health Professions as ADR, and Dr. Halterman is also ADR, Senior Associate Dean for Research in the Jacobs School. So the intent was for us to reach out to the talent that we have on campus to query them on their experiences specific as to NIH review panel. So thank you to each of you for joining. And I think that I will start off the questions. And I think Dr. Barrick, if I can pitch the first one to you.
Sure.
Could you, the things that we're going to talk about first is just understanding a little bit of process. So can you give us, from your perspective, what the overall structure of an NIH review panel looks like and who you typically see serving on the panel?
Sure. Of course, all of these things are variables that may change depending on what panel you go to. But typically speaking, get about 40 or so people who are expert in the field of review for the panel to which they're serving. And so it might be in addictions, it might be in some other healthcare research, it might be in nursing. And the panels typically have a focus. And typically the people who serve on the panel have been funded by the institute, that is associated with the panel or have had funding in an area that is related to the research conducted in the panel. So typically what we'll see is it'll be composed of people who've had NIH funding experience, typically as PI, and are senior enough that they've been able to run their own project, run it successfully, and are selected by CSR, which is the Center for Scientific Review, which is the organization that oversees all of the NIH review panels. And there's been a shift. This is a brief aside. There's been a shift in the last year or two where institutes that you might apply to for funding in the past had their own research panels, and those have all been moved under one domain for the Center for Scientific Review. So in the past, if you were funded from NIDA, if you were doing drug abuse research, they had their own panels, and NIH through the Center for Scientific Review had review panels. But now they've been all moved over into one, and which is actually probably better in the long term. Although if you've been funded by a review panel from your institute, you're kind of sad because that's where you got your money from. But I don't know. Does that answer your question? Is that what you were looking for?
Yeah,
Okay,
no,
super.
I think that that's terrific. And so I'll bounce the next question to you, Dr. Halterman. We recognize that a lot has changed in the process, but you've served on a number of study sections. Can you explain to us how the applications are assigned specifically to study sections?
Yeah, we, as Chris just mentioned, we typically align with various institutes for our work, and those institutes have expertise that coalesces in these study sections. It's interesting. There are many changes going on, and some of the study sections are undergoing some revised composition as they're looking at the disease focus and maybe thinking about more general principles. So again, it's an interesting time with some, I think people are a little nervous to see how things come out, but just my study section, for example, is disbanding and it's going to reform, and there'll be some new talent brought in. So applications get assigned, you submit to the NIH, you can make some recommendations about uh, what your best scientific fit is, suggesting the study section, the institute or center. Um, but generally, the NIH staff will look at this and make the final assessment. So they'll certainly take your recommendations, but in the end, it gets kind of sent down its merry way. I don't know internally what their process is, if there's any AI that's looking at this now and helping to make assignments, but presume that that will be coming if it's not here already.
Thank you. And Dr. Collins, when you're sitting in section, what are the main criteria that you're looking at from the perspective of review for scoring?
So my two colleagues have mentioned that review is in flux, and one of the things that's changed is that we've moved to a three-factor review process. Factor one focuses on the importance of the topic. Factor two is approach, how appropriate or how strong is your methodology. And factor three has to do with the investigator and the environment in which the research is being conducted. I reviewed last June when this new system was being implemented. And one of the things that was striking is how factor three is now a single question. It's a yes, no as to the appropriateness of the environment and the investigator. And as someone who's been on IRGs and lots of SCPs over the years, I was not happy with that change in factor three because, among other things, new investigators used to get at least a sentence that might comment on them as PI or the quality of their team. Environments, most universities would get a pass. But now it literally is a single question to which you respond yes, no. The other thing that's uh, kind of changed, we're still using the 9-point scoring system, but now we're looking at kind of three boxes. One is the high rating, the 1, 2, 3. Medium rating is 4, 5, 6. Low is 7, 8, 9. And another factor is that in the past, we had 50% of applications being triaged and not discussed. Now we're down to having just a third of the applications discussed, which again is a little unfortunate because what it means is that we're missing out on discussion of more applications. Yes, you will get the written review, but there will be no comments around what the discussion at the meeting involved. So I'll stop there.
Thank you for that. And obviously, and I have some data that I can share at the end of the presentation that you all have access to, but NIH is reporting right on their primary site the number of awards that are trending month over month. And you can see, unfortunately, the decline in the number of awards that are being made.
Jill, can I make a comment about the factors? So there's also been instruction at study section to think about these factor 1, 2, and particularly 1 and 2 scores and how we are assigning those numbers. And it had been the case, perhaps there was a perception that we were looking at averaging each of the subscores in the prior methodology, right? So if you had significance score of a 4, but the science section was written in just really beautiful grantsmanship structure, then you would elevate that grant. The problem with that is it's a bit of leaning your ladder against the wrong tree. And so the philosophy now is your significant score, significant
Is
idea, innovation, impact, these sorts of things. If it really is okay, but it's not that exciting and the study section doesn't feel it's going to move your science, it sets the ceiling.
yeah.
So you cannot have a factor two that's a number one, right? A top score flawless that brings a four higher.
Mhm.
So when you're writing your grants, think big, right? Think realistic, think what's going to move the field. Think, even though, we're talking different kinds of grant mechanisms request different levels of innovation, R21s. Generally, you really want to be paradigm shifting, something that's really going to move the field. R1s can be more incremental, but you still want to really nail the significance so it's crystal clear. It can be an old disease, but a new angle on it. So I'll just stop there, just so people think a little bit about how those criterion scores um, might throttle their overall scoring.
Thank you for the follow-up on that. I do have a follow-up question for any of you or each of you. Um, are there differences depending on the agency that you're reviewing for? Do you see it? Is there anything is it all consistent, or are there things that change based on the agency?
So we're no longer really reviewing for agencies. It used to
Yeah.
be, that, like, for example, Fs would be reviewed within an institute. T's, training mechanisms would be reviewed within an institute. Now everything goes to the Center for Scientific Review. Um, so the agencies get involved at the funding part of review, but they're no longer involved in the review itself.
Thank you. So Mark, you sort of, and I'll bounce this to you because you sort of alluded to this a little bit, but one of the questions that we wanted to pose is, what happens during discussion of an application that applicants may not be aware of?
Sure. So let me pick up on sort of the tail end of the review criteria because it bleeds into this concept. So there are also these additional review criteria that are either scorable or non-scorable. And for those of you that have already written your grants, you have your deadlines, you get to that weekend before it's due, and you're like, oh, I'll just bring the vertebrate animal section over, or I'll use, right? Problem is your human subjects, your vertebrate animals, biohazards, those are reviewed with scrutiny, and uh, you may not know that they are still very important. So if it looks like you kind of did a little bit of a tailspin on those other sections, and particularly if you described a surgical procedure that you're not performing in this grant, that care or lack of care is noted. So it can come into the scoring. So assign reviewers, you should know 3 reviewers. First reviewer tells the story of your grant, generally has 5 to 7 minutes. Think about that. So if you have a 12-page grant, pretty dense, they have to talk about your impact, significance. They have to talk about how you're going to do the science. And if appropriate, they'll say a few things about the investigators, and they've got to kind of sell you on it. Reviewer 2 has 3 to 4 minutes. And reviewer 3, if they agree with 1 and 2 and don't have any major weaknesses or reasons to sort of elevate the grant, they can just take a pass. So your grant can rise and fall based on A, did the investigator understand what you're talking about? And they may not have domain expertise in what you do, even though that study section was pulled of standing members and ad hoc members that are brought in to be able to cover that. So they focus on score driving strengths and weaknesses. And after the first 3 reviewers speak, the rest of the panel will join in for the discussion. And this is where things get really interesting. So questions will be posed, they'll be bounced between the first, second reviewer. They'll kind of lean in there. And what you should know is that the committee's role is not to reach consensus. The role is to be able to lay out what are the different angles on this, sort of orthogonal coming in from different perspectives, and the committee then all vote. So you can see how if maybe reviewer two didn't get it, and we've all seen those reviews, how things can really run off the rails quickly. Really good ideas maybe are missed in the static. So it underscores a couple of things, not the least of which is being able to write clearly, lay out your grant in a way that is easily reviewed, and you make your points, and those will really shine through and they'll come through in the review. So you do yourself no favor by being inconsistent between your sections. The amount of detail that's presented in the section should be balanced, and you should have a good strategy for how you're visually presenting that. And then, I mean, I can go on and on, but visuals on the figures, making sure your stats look good in the figures, it all matters.
Mark,
So I want to add,
Oh,
I have a question that I want to, Mark, could you talk a little bit about range and voting out of range? Because that sometimes throws people off and so the number that they're getting really doesn't match what the main reviewers might have used.
So you'll finish with your scoreable items. The group will have heard about and asked their questions. You'll return, ask the reviewers for they had preliminary scores, and then everybody will ooh and ah if there's a 2 and a 6. And then you'll get back to it, and some people will shift, some people will not. If the range tightens, but there are people that love the grant and they're above that range, or they really hated it and they have substantive reasons and they're lower, they will raise their hand and say, I'm voting outside the range. They will give their reason. So when you see your reviewer scores come back to you in your pink sheets, and we call them pink sheets because we used to get them in the mail and they were carbon copies and they were pink,
yeah.
you will see that perhaps your scores don't match the final score that you're getting. So that is why there are people voting outside the range, good and bad.
so I want to add to what Mark said, both with regard to writing and with regard to what happens in review. Two very important parts of your application are specific aims and abstract. And the reason why those two pieces are so important is because other than the three assigned reviewers, those are the components that likely will be read by the other reviewers. There is a lot of work to reading an application, and the three assigned reviewers do the bulk of that work. But interestingly, all of the people on the review panel get to vote. And so if you're not assigned a grant, the expectation is that you will at least read the abstract and the specific aims so that you have a sense of what the grant is about. And that sense will contribute to the questions you ask, including obviously what the reviewers mention. But sometimes there'll be an aim that neither the first or second reviewer mentions that you read that kind of intrigued you, and you're like, well, what about the aim that involved this approach or this population? And the only way as a non-assigned reviewer that you know about that is by reading the specific aims and reading the abstract. So the three reviewers do drive the scoring, but the expectation that the other reviewers in the room will read at least those two documents is a really important part of preparing your application.
Jill, if I may add just two other things too,
Sure.
at least in my experience, the two things that are also involved in sort of the dynamics of the review. The first is, and this is kind of a hit or miss thing, and as a person submitting a proposal, you have no control over it. But different study sections have different cultures and how they review things. The studies section that I chair is great because we actually have timers. And so we have timers that notify us, not to interrupt us, not to stop us, but to keep us on track. Because one of the things that happens, especially towards the end of the day, or especially with intriguing grants, is discussions can get very, very long. Now, technically, you're supposed to have 5 to 7 minutes, or maybe 3 to 5 minutes if you're a reviewer 2 or 3. Doesn't always happen that way. And typically, my SRO always reminds us that longer discussions tend to drive scores down worse. And so he's great about making sure the time allocation is fair. I've been on study sections where there's absolutely no track of time, and we can have crazy long discussions, and it generally does more harm than good. Um, Second thing that's probably worth mentioning too, as of November of 24, I believe almost all, if not all, of the reviews are online now. And so we meet by Zoom. We met by Zoom and then by Teams, and the people didn't like it, and so we're back to Zoom. But it's a much different dynamic, at least in my experience, to being on a Zoom meeting doing reviews than being in person. I like being in person a lot more, and I thought the discussions were a little bit better. But it's definitely a somewhat different dynamic. And in both cases, whether you're timing or not, or you Zoom or not, the kind of the moral of the story that I think everybody should take home is whatever you do when you write, don't make your reviewer work. Because if they're having to work to understand what you wrote, it's not going to bode well for your application. And there can be a lot of discussions about minutia because things aren't clear, and that's never good for your score either.
So to your point, Chris, and
Yeah.
I to what both Dr. Collins and Dr. Halterman have said, if you're in a group where there is somebody voting out of range, as you posed, or the conversation is going on for a significant period of time, and maybe there's people that are part of the review process that are less familiar with this particular, aspect of research. How do groups come to resolution, and how do you resolve disagreements
Well,
in those cases?
yeah, no, I'm sorry, I didn't mean to interrupt you. We actually, well, we don't, and I think Dr. Haltman mentioned we don't go for consensus. I guess we go for satisfactory answers to the extent that they're possible, because people will be presented with the same evidence and draw different conclusions. And so we can have a great discussion where we have a very wide range of scores because people see the value of the different components or the aims or the approach differently. And so we always try to aim for just a satisfactory discussion. The way my SRO always phrases it is give people the review you would want. And so we try to be fair about it and try to, bolster our point with, evidence that why we feel something is good or bad. But there isn't any effort, at least in my experience, to try to have everyone come together on a score. Very typically, if you have enthusiastic reviewers, your score will be better. And if you have enthusiastic, reviewers, it's kind of infectious, I think, with the other members of the panel. And especially if it's a standing panel and you've known your colleagues for a long time, you begin to trust, or maybe not, but in most good situations, you begin to trust their opinions and their, the way they review things. And so that can carry a lot of weight. So I guess so I just summarize, we wouldn't aim for a consensus, but we definitely, we'll aim to clarify and get a better sense of what the goals of the application are.
Jill, I'll add 2 points to this, and the overall push to make the changes is to remove bias from the process as much as is possible. So the SRO, the scientific review officer that is there to oversee the meeting to ensure standards are met, to ensure that reviewers understand each of the mechanisms that are being reviewed, because they can be very different. And you can run the risk of bleeding over from one instruction to the other and maybe making the wrong assessment.
Right.
The other change that occurred is the chair no longer summarizes the application, which is filtering filters, right? So I actually think it's been easier for the chairs, of course, but I think
Yes.
it's a move in the right direction that you don't insert yourself in the middle of this, because we are all biased, and it's just it creates some problems. And so what it does now is that all of the people on the committee realize they need to pay attention for everything, because it may be the case they drift a little bit and then they would just wait for the summary. So I think overall, Although I agree with Lorraine, I miss hearing more about the investigators. I think overall there are a lot of positives to the changes.
Yeah.
Thank
Yeah,
you.
I will add, and Dr. Halsman, I'm glad you made that point. It's interesting. The chair, speaking about sort of the culture of the meeting, the chair is, sort of like the traffic cop, I guess, in some respects, where you're trying to sort of guide the discussion, again, not for consensus, but just for fairness. So everyone gets their time, but also manage the time so it doesn't go over. And it used to be very challenging to try to summarize the meeting. What Dr. Hoffman was describing, which is the chair needed to pull out key points from the three reviewers and kind of put them together in a brief summary. And and as Dr. Haldeman was saying, there was, I'm sure unintentionally most of the time, a tendency to try to include, at least I know for me, try to include positives and negatives for every point, even if some of the points were less positive than others. You try to balance it out so everything's represented. And that isn't always a reflection of the discussion, because the discussion can be a little bit more lopsided. So I agree. I think especially that aspect of the scoring changes is great, although poor SROs have a lot more work to do.
I think another dynamic that is worth mentioning is that you have IRGs, initial review groups, that have standard members, and then every meeting you have people who come in on an ad hoc basis.
Yeah.
And the dynamic of the ad hoc versus the standard sometimes comes into play. The ad hocs often don't know the members of the committee, as well as the members of the standing committee know each other. And it's human nature that in some cases you get the sense that the ad hocs, even though they have expertise on the topic, may not be viewed as positively as members of the committee. I mean, it's, again, hard to quantify what goes on, but you do see it. When you have special emphasis panels, what they call SEPs, they're all ad hoc, and so that actually creates more of a level playing field for all the reviewers. Just want to mention that difference between standing committee and special emphasis panels.
Thank you. So one of the topics that we wanted to talk about was scoring, but you've all touched on that really nicely, I think, in a lot of your different comments and explaining some of the changes. One of the questions that we did have as related to scoring and decision making was, what distinguishes a fundable application from one that just misses the pay line? And now, keeping in mind that that's probably very different now than it was a year and a half ago, but would each of you be able to comment on that? Dr. Collins, do you want to go first?
I actually don't, because it's so complicated. So the funding decisions are made in the institute. Once the review is done, the scores and other aspects of the review are shared with the institute, and the Center for Scientific Review's work is done. Once it goes to the institute can then implement its own criteria for what gets funded. There used to be a time where scores or percentiles, in the case of R01s, for example, were really the focus of attention. Now I'm hearing that that may not always be the case. We have a situation in which people who are in or maybe even outside of the institute can make choices about what gets funded. I don't know all the details about how that happens, but I've heard that it is happening. And the criteria for those decisions, I cannot describe. But within an institute, when things are working well, you have a program officer that's been assigned to your grant, and that program officer meets with the other program officers in that division. Let's say it's epidemiology or biomedical research, whatever. And then they talk about the scores. They talk about the applications that they've been assigned, and they come to decisions about what to fund and where things fall in the rankings. We do have, for example, provisions now for early stage investigators that get a little bump up in the funding. And so there are criteria that might help a particular PI. It's not a huge jump, but it is considered. People's track records get into being considered, and just I think the advocacy of the program officers can be really very, very important in what gets funded and what does not. Anyone else want to add to that?
Well,
It is a
the only
complicated
thing
mess.
I'll say too, part of it is who you're up against. By the luck of the draw, depending on the other individuals who submitted grant applications, and within a few months of you, that's your competition in some respects. I think it's kind of hit or miss. One cycle, the funding line is going to be different than another cycle, and that's sort of just the way it is. So it's very unpredictable. And then there's also just the sort of the impulse to spend your budget. And so it's not uncommon if you scored well but weren't funded initially in the year, at the end of the fiscal year, if there's a pool of money left over and your budget is a nice fit for that hole, that you'll get funded. It doesn't mean you're going to have a terrible score and you'll run all the way up. You have to be competitive, but that's a second unpredictable element in terms of what happens.
So your grant can be active for 3 funding cycles.
Yeah.
And so if you get a good score and it doesn't get funded initially, it will get into the second and then the third. And as Dr. Barrett mentioned, the fiscal year ends September 30th, and there is a lot of activity in the month before that, where applications can get funded. But funding is, for the most part, unpredictable these days.
So
Dr.
Ask a
Halterman?
question.
Yeah.
I
Go
want
ahead,
to ask a
Gustavo.
question for Lorraine or anybody else to expand on how do I mean, you can answer later, but how do resubmissions get reviewed versus first submissions? What are the considerations? How does that discussion go?
So I can take that one. The reviewers will know that it was a resubmission. An A0 is a first, and A1 is a resub. The application requires an introduction, single-page response from the grant writer. What did we change? What did we focus on? What did we think the reviewers got right, got wrong? And it's written, generally, if it's done well, it's very diplomatic. It's not good to be mean to your reviewers because you may get the exact same person. And then you lay it out. You made these changes, and thank you so much for your response, etc. However, it is not uncommon to have 3 new people reviewing this grant.
Yeah.
And you're actually, it's a double bind because you wrote and responded to what it was that they had problems with, but now somebody with fresh eyes maybe doesn't like another part of the grant they didn't comment on, or they didn't like the approach that you took and they liked it the first way. Now, there's a conscience, generally, I see this, and Lorraine and Christopher, maybe you guys see this. We want to be fair.
Right.
And, the study section suggested all of these things. And so it's a bit of a mental averaging that occurs.
Yeah.
And overall, right, uh, things get better, I would say. Did they get better enough? And so you'll get in your in the conversation, it will be, was the reviewer responsive? Now, we can't just use that alone as the sole criteria for whether the score gets pushed. You can respond to all the comments, but if it still doesn't hang together, it should not be scored more favorably. So it's complicated.
For our panel, what usually happens is one of the three reviewers will get reassigned at the resubmission, but then the other two will be new. And in part, again, it's to sort of balance the need to really, look at the application as a whole. Is it a strong application? But then also kind of acknowledge the fact that, at least one of the reviewers was there the first time, and we'll see if the changes that were made match the suggestions. And they sometimes they do, sometimes they don't. Sometimes people are very industrious in their changes, and sometimes they're not. And that all that plays in. So I think by and large the recommendations are always helpful or intended to be helpful. So hopefully it advances, and you get a more positive review, but it's also hit or miss.
So, Chris, your review panel is nicer than many, because you have one person
Yeah.
who was involved in the previous review.
Yeah.
What I've seen is it can get assigned to 3 new people, and the notion that, oh, if I fix what the reviewer said, my score will improve, does not hold up. There are many situations in which the score gets worse. So I just want to caution people
Yes.
that even though you're doing everything you can
Yeah.
to respond to reviewers, that is not a guarantee of an improvement in your score. Chris's point about the competition, I think, also might play a role.
So, Jill, your original question, what is it that makes that difference? And so maybe if you just think about 100 applications that go to a study section, 3 per year, and you set the cut that 50% of those will not even reach the conversation, and now things are, as Lorraine points out, a third of them are actually going to be discussed.
Yeah.
Remember the distribution of the scores, right? A one. If you see a 1, there's got to be like some really magical unicorn flying through that room.
Right.
And it's an idea that just must happen. And it happens every once in a while. It's pretty rare. So you see scores that are bunched up between, honestly, the 3s and the 5s. If you've got a few, and if you haven't heard about these, you should look at the nomograms, right? So 1 to the 3, maybe a collection of minor weaknesses. The 4s to 6s are moderate weaknesses, but nothing fatal. But then anything 7 to 9, right? Fatal flaws. Contingency and aims, lack of expertise, the premise isn't there. So here you are, everybody's fighting in sort of this border zone of the 3s to the 5s, and everything's all bunched up there. And so now you're getting into really splitting hairs. Again, I'll just get to the point. Um, your idea has to cut through, and you also have to submit a lot of grants because you never know what the study section's going to see.
Right.
So when you get triaged, I'm trying to like buoy everybody's morale here. You could have written a really great grant.
Yeah.
And it's just kind of where things fell. So it's part of the game. It's implicit that you reload and fire again.
So I think the other thing is NIH, especially these days, is suggesting or listing topics in which they're interested. And I would at least look at those lists, just to see, might your research idea fall under any umbrella within NIH or within a particular institute. So I think that's a useful way to consider the process. The other thing to know is that science, regardless of mention of innovation, is inherently conservative. And so if you have a brilliant idea, but it's not within certain parameters of what the reviewers are used to seeing or are used to thinking, it probably won't fly. Even with the factor 1, 2, 3 approach these days. People tend to appreciate approaches that are familiar, that are well defended in science, and, you know, at least are supported by your preliminary data. Let's not forget that, because you may have to make the case for what you're doing, regardless of the brilliant idea, in your preliminary data section. So the idea is important, but it has to be supported by strong science. And, you know, when you're asking for $3 million, people are going to say, well, we shouldn't. We're told not to consider the F word,
Right.
but it comes up. Even if
Mhm.
it's not in discussions, people think about, you know, is this worthy of whatever level of funding? Are these ideas really going to make a difference?
Thank you. So I think it's worth commenting. I know that we're discussing NIH right now, but many of our investigators are looking at PCORI for a number of different reasons. It's a very good fit for the university from my perspective, and it's also it's a different mechanism that's very stable. A PCORI panel has 5 reviewers. If somebody does resubmit, PCORI does everything that they can to try and reassemble that panel as best as possible.
Wow.
And they're making efforts to do that. The other beautiful part about PCORI too is that it's a 2-step process. So you can toss an idea out and have it vetted via an LOI before you have to go into full proposal, which I think is also it's a good approach from their vantage. But so basically, and if you give me like your top 2 or 3, I'll go to each of you and ask from a practical perspective, what is one or 2 of the most common mistakes that you see investigators make in the process of their proposal? So, Chris, I'll go to you first. You're nodding your head.
Yeah, that's a really good question. And I often say being on a panel has not helped me write a better grant, but it's helped me avoid stupid mistakes. And typically what I see, one is people who didn't proofread their application. And I don't mean necessarily misspelling, but inconsistencies within the document. Maybe their specific aims don't actually match their approach section or something along that line. I think that is the easiest thing, to do, which is just review and maybe have somebody else review your grant so you can catch, those sort of mistakes because those are really, really costly. Let's see. The other thing I think, especially for people submitting grants for the first time, I think they tend to overcomplicate their applications. And I think, streamlining, and I don't mean simplifying in a bad sense, but making an application, straightforward in terms of its goals and its techniques is really, really helpful because sometimes, people will come in wanting to change the world in one application and you can't do it. But if you can have a straightforward, narrowly focused thing that's easy to understand, I think that has a much better chance than something that's overly complicated, mainly because it opens up so many places for critique. So those would be my 2 things.
Dr. Collins, how about you?
Inadequate data analysis sections.
Yeah.
People have these wonderful ideas, these wonderful approaches, and then they have a paragraph for how they're going to analyze their data, and it will not fly.
Yeah.
So if you don't have the expertise personally, please make sure that you include a biostatistician. And even if you have the expertise, I think reviewers like to see someone with a statistical background is part of the team so that they can say, oh yeah, that will fly. I think that's really, really important. Titles. Titles, at least for me, can set the stage of what to expect for the rest of the application. And now, titles can be quite comprehensive, and it's useful to tell the reader right away what your research is about. In the bad old days, you had only a set number of words. It's still set, but there's so many more ways that you can express what you're going to do. So I'd say biostatistics and title.
Thank you. Dr. Halterman?
Yeah, being clear on why you're writing this grant and the mechanism that you're writing to. So fortunately for many of these, they cheat and give you the review criteria at the bottom. So read those and think it into to Lorraine's point, the section headings guide your reviewer's eyes and help them understand, oh, this is the part where I need to write innovative things about this grant, right? Don't make it hard for them to find that thing they need to fish out. Don't assume reviewers are the niche expert, right? So that gets at being able to write in a middle zone. They know you're going to write really great papers, but you got to be able to dial it back and get into that sort of sweet spot. And on Lorraine's point on the experimental design, so power calculations, sex is a biological variable, at least for the NIH review. You just have to make it clear that you thought about it. Don't give it a nod. You got to lean in a little bit. If you're not going to do it, explain why. If you do it, explain why. I see applications run out of steam all the time at alternatives. And that really gives the reviewer a sense that you recognize you're not perfect. We know you do these things in your lab. We expect the first sentence will be, we have all these techniques in our laboratory. We expect no problems. I'm sorry. What universe do you do science in? So you got to be able to see if what you're proposing is impactful enough, it's going to be hard. And if we don't read in your application that you recognize there'll be some challenges, you probably haven't thought hard enough about it. And then one more and I'll stop. Figures, resolution, statistics in the figures. Do you have the proper controls? I think everybody is so hurried to get preliminary data in there, they don't really give it the care it deserves and the interpretation. So you'll get yourself into a real pickle if you don't give somebody that hasn't read this application and let them go through and look at your data that you're presenting.
Can
Thank
I
you.
add one? Because being in a lot of study sessions, one that I see and I'm seeing a lot more and reviewers get kind of frustrated with is that aims that become what sometimes is referred as Excel sheet generating exercises, in that you're gonna do some seek or some analysis and get a lot of data, but then it's unclear what you're gonna do with that data. Right. So you have to have a plan forward. It's understandable that you're gonna get a list of genes or proteins, and then but what is it that you're gonna do? What's your criteria to concentrate on a few targets, and then what are you gonna do with it? So moving away from just getting the data and that data analysis that Dr. Collins mentioned to what you're gonna do with it.
Thank you.
So this isn't part of the focus because we're focusing on review, but please do not use AI to write your grant applications. I mean, I see graduate students doing it. I worry that publications are going to start with that. And as a reader, you can pick up on that relatively easily, and you will get nines if you use AI. Most reviewers will be outraged. So It's not a review criterion, but I'm just mentioning it because it's starting to kind of take hold in a lot of ways in research.
Well, it does seem like a common mistake to mention. So before I open up to questions, if anybody wants to pose something specific in the chat, please feel free to do that right now. But I want to bounce the last question to Gustavo. So Gustavo, you help a lot of people through the tenure process and the promotion process, and you've mentored a significant number of people over the years. So tell us what your thoughts are on the benefits of serving, when's the right time in a career trajectory to do that. How do researchers jump in? And I know that you've got something in the website as well. So
Yeah, so I would say two things. One thing in terms of mentoring early stage faculty and grant writing is that that's a really good correlation between how many people read your grant before you submit it and how well that grant does, right? So that means that you really need to make an effort to get things done early enough so that you can get meaningful feedback. So establish a team of people that look at your grants before you send them out. I think that's really, really critical. Those are the people that are gonna pick things like, I can't see the figure very well, or the title really doesn't really capture what the grant's about. There's a discrepancy between what you say here, the hypothesis is, and what you say over here on this other page, what the hypothesis is. And have a collection of readers that are experts and non-experts, because those are two very valuable. In terms of when to serve, I think the earlier you do it, the better. It is work, but in terms of the return on investment, it's high. Partly because, as most of the people refer to, you learn a lot from how these things are reviewed. You heard from all three panelists, which, by the way, amazing panelists, that it's sort of the culture of the study session, right? How it behaves. And you can't get that from the pink sheets, which are not pink anymore. But Mark H does. They were pink at some point. So you don't get that from that sense from the reading the review. So being in study session, the earlier the better. I posted the NIH early stage faculty review program. Once you submitted a major grant, such as an R1, and you've gotten reviews back, you can apply for the program. They're usually pretty kind and give you only 2 or 3 grants to review. And you get to attend study session and you'll learn quite a bit. So that's the first way that you can do it. Also, one thing that I would say is that while all institutions and all organizations have their own criteria, their own sort of culture, the way that NIH is so big, and most people that are reviewing in American Cancer Society have review for many years in NIH. So what happens is that culture sort of spreads out. So even if you review an American Cancer or American Heart, you're gonna get a good sense of how review panels work.
thank you.
And Mark probably can add to that too, because he's mentored a lot of people as well.
Yeah, I mean, I think in terms of the timing, it's good to kind of get through that cycle a few years, get some scores back, kind of see how things work. The program that Gustavo, that you shared in the chat is relatively new, so I haven't investigated it. But I think any opportunity you have to get involved in these review processes, take it. It is a lot of work, and your family will see you disappear and lock yourself away for how many ever days it takes you to get through your stack of applications, but you come out the other side and you really learn how to look at science from a different perspective. It improves your writing. It makes you see sort of the patterns that should exist in your own grants. how people block ideas. It's really, I don't know, you kind of get into a trance, honestly. Maybe I'm a little weird, but Lorraine, I don't know what it's like for you or Chris. Um,
Do any of you have a sense of what percentage of our faculty actually do participate in review?
I do not, but picking up on what was said about reviewing for other funders, it's probably useful even to review for journals because that's kind of a soft way in to the whole review process before you take on NIH. Anyway, I just want to mention that because your chances of being asked to serve on an NIH review or an SEP are probably less than it is to be asked to review for a journal.
Thank you. So I had posed that we could put some questions out. There was a question that Dr. Lilvis in School of Public Health asked. Dr. Collins, I think I'm just going to forward that to you via email to be
Okay.
considerate of time because I know that it's we're 2 minutes out. I just want to thank the panelists. You've done remarkable work, not only on behalf of your own research programs, but on behalf of researchers and serving in the capacity that you have, in addition to mentoring. So thank you for taking the time to do this today, share your thoughts with us, and hopefully have schooled a number of people on what it really looks like on the inside of the process. Gustavo, do you have any last thoughts before we
What I
jump
want to
off?
say is that we're very lucky to have had an hour with Lorraine, Mark, and Chris. I have quite a bit of experience in panels, review panels, and everything that they've said, I wholeheartedly agree with. So there was a lot of wisdom there, and I hope that people take heed of their comments and their wisdom. And so I thank the panelists profusely for their time and wisdom.
Thank
My
you all.
pleasure.
Thank you. No, you're very welcome. Thank you
Truly,
very much.
Yeah.
very much
Pleasure.
appreciated.